Welcome to the Pharmacy Residency Podcast, a part of the Pharmacy Podcast Network, but also a part of Residency School. So if you're always looking for any courses, blogs, podcasts, and books related to residency, go to residencyschool.com and you can find all of the courses and books and everything that we talked about in this episode there. Well, without further ado, let's get on with the show. Welcome to the Pharmacy Residency Podcast. Remember the Pharmacy Podcast Network. We had a great interaction with MCPHS, which is a pharmacy school out there in Massachusetts. And they had set up a bunch of residency questions. And I thought, maybe it would just be kind of cool to answer those questions as a podcast episode with the screen and kind of some notes and things that I had and just kind of talk about some of the things with JC Mandernack, who is P4 with the University of Iowa, who is working with me on an academic rotation this block. So welcome, JC.
Thank you. Hello, everybody.
Okay. All right. So let's start off. I think I answered what was the biggest challenge for me as a pharmacist. Physically, I had actually, because of the stapling, we used to use one of those like staples where you literally squeeze it every single time. And I was squeezing kind of hundreds of staples and I'd gotten really bad with that. And then my knees had gotten really bad because my IT bands were locked up from working 12-hour days. So those were kind of scary, but I took the time to talk to my supervisors and eventually kind of took some of the burden off. Electric stapler, kind of sitting down on a stool to alleviate some of that pain. And then eventually the inflammation went away and things worked out. And then mentally, I really struggled. There was a bit of a power struggle with a grocery chain that I had worked in between the manager and myself. And it was just too much, and ended up kind of taking a step back, going to mail order pharmacy for a little while, and just recognizing that your career doesn't have to be at the same place for 20 years or whatever it's going to be, and that you can make midpoint corrections. So biggest challenge for you, JC, in pharmacy school before you're becoming a pharmacist, I guess.
Yeah, so I think for me, one of the biggest challenges has been my confidence in counseling. I look pretty young, and so just being credible to the patients that come into the pharmacy. I'd worked at a compounding and retail pharmacy, so a lot of variety of patients that come in wanting to know about the unique dosage forms that we make at the pharmacy. And so I had to definitely take some time to learn how to counsel on all the different dosage forms so that I could be more credible and confident in the things that I was saying. But it's still been a work in progress for me over the years.
My wife is 5'4" and looks young as well. And every once in a while, someone would ask her if they could speak to the pharmacist, which was the male technician to her right. And I tell you that nothing irked her more. Well, some other things, but it was definitely one of those things. And it is a challenge, credibility. You want that, pathos, logos, and ethos with the patient, and they want to be confident in you.
Sure.
It's not unique, certainly. How would one succeed with very average grades, GPA, or grades as a deciding factor to getting a residency? I had said that, applying to the lower tiers, and I hate to use lower tiers because there is no tier 1, tier 2, tier 3 like there is for maybe MBA school or law school. But really, it just means that something different is going to have to make up for that missing GPA. And that's usually going to be a relationship with the APPE that you've had 5 weeks to prove yourself. And they're like, well, maybe they have a 3.1 or a 3.2, not really as worried about getting somebody with a 3.8, 3.9 over someone that we know really well. Knowing the cutoff. So some places it might be 3.2. And once you meet the cutoff, there are no additional points for higher GPAs. That's it. And if you know the cutoff, to just not apply to places where that cutoff is there. Generally, that cutoff is pretty strict. And then maybe you had to work extra hours because you needed to support yourself, or you support yourself and your family, or support yourself and a child or something like that. But in essentially somewhere like an academic medical center that it's going to receive multiple hundreds of applications would be a very difficult thing in terms of grades. But JC, how would you answer something like this? And I'm not saying that you have bad grades. I'm just saying, how would you answer this for someone that might?
Yeah, I think I would definitely focus on your other parts. If you know that your GPA is not your strong suit, focus on what is your strong suit. Did you volunteer at a really cool thing every year or multiple times a month? Talk about that. Or if you have a passion about some club you were in and president and spend a lot of time doing that, that is what you should focus on rather than focusing on how poor your grades may be, or like you said, the relationships. I think that's key to keeping up with people. If you met them your first year of pharmacy school and think it's cool what they do, keep in touch with them some way, and they could be a great resource for you, or possibly end up getting a residency with them.
Yeah, I'd put the note for the extreme LOI course, just because the letter of intent is that place where you can explain those things and talk about those unique things that JC's talking about. How would you start researching what residency interests you? I personally wouldn't. If I would start research, so I guess I'm a little maybe too pragmatic, too practical, where my first research would be into the students that were successful from my college. And I would start talking to them about what worked and what didn't. And then I might start branching out into those other places that I might be most interested in. But I would want to know what the factors are that are going to create a successful one, so that instead of just kind of, ooh, what would I like to do and where would I like to go, I would kind of have a little bit more backstory from some of them. And then JC, I think when we were talking to MCPHS, you mentioned that you kind of did something similar in talking to some of your classmates.
Yeah, I had no idea how to start researching. It was something I was very uneducated about and seemed very overwhelming. So I had reached out to a couple of past pharmacy students, so they were in residencies now or beyond. And I just asked them for advice on what do you look for? How do you know what to look for? And so one of them was gracious enough to send me her Excel sheet of what she had. And I made one similar but more tailored to my likings, and just looking for programs that had what I wanted in them. You know, things you could look at is even down to the cost of living in the place, if that's something that concerns you, or rotations in different residencies. Do they have a teaching component to it, or whatever it may be, what you want? But I had started looking at the ones that she had listed because we seemed pretty similar in our likes. So I started there researching them, and then kind of went on from there to look at other programs that were similar.
Awesome. So tell me a little bit about that worksheet. You had mentioned some of the things in there. You don't have to mention all of them, but what tabs would you use in your Excel worksheet?
Yeah, so on the left, I would always have the program. And then from that, I thought the important things were what rotations they have. You know, is there a lot of infectious disease? Is there a lot of acute care versus ambulatory care? Things like that. I would put on there the cost of living after I looked it up just to see what it was in the place. And then if there was a teaching certificate or not, that was something that was important to me. I also put in the staffing component in there if they had it listed on the website. Otherwise, I would email and ask, you know, is it every weekend? Is it 2 nights a week, 3 nights a week, 1 weekend a month? That kind of mattered to me a little bit in helping make the decision. And then I think I also put on there the salary if it came down to that, and then how far it was from home, just as another thing to put on there. And sometimes some other benefits that they listed or extra notes, you know, like you get to present at this different place, or you get to precept students, if any additional things were on there. I just kind of put them, whether they be pros or cons.
Yeah, but it's definitely not you can mathematically figure it out. There's some kind of pieces that have to come together, and then you have to make kind of an intuitive decision at the end of the day when it comes to ranking.
Oh, yeah.
Yeah. Okay. All right. So In your opinion, what is the most important to focus on during interview preparation? How can I best prepare for residency interviews? My thought was one, the residency interview course, so the residency.teachable.com /interview. That will give you about 3 hours to understand the point system and to know that there are actually usually 3 interview scores. So you'll have an interview, which is the traditional interview that you're used to, where you go and you meet the people. There's another one that's the case presentation. And then there's the clinical one where you have to, there's a clinical presentation and then there's the clinical case. And most don't realize that the clinical presentation, clinical case together will probably way outweigh that traditional interview. And that's because you're being hired for a job as a clinician. So it makes intuitive sense when you think backwards on it, but those are the things that I would think about there. And then understanding the questions. So Brandon Dyson and I wrote 100 Strong Residency Interview Questions, Answers, and Rationales. And the reason that we really love that book is that you can just kind of listen to it on your way to residency and back and just kind of absorb those 100 questions and how to answer and how somebody would answer them. What do you think in terms of interview preparation? How do you get ready, JC, for two very different interviews? Because a residency is not a residency is not a residency.
Every interview can be very different, that's for sure. And as you were talking about the case presentation, there are even differences within that. Sometimes you prepare one ahead of time and you present it. Other times it's kind of more on the spot that you are talking about a patient case that they throw up on the screen. Our interviews were virtual. And then you talk about it and answer some questions about what you would do with it. So just preparing for that would be mostly studying your pharmacology things. Other ways to practice would be actually talking out what you want to say rather than just playing in your head what you think you may want to say, because when you actually say it out loud, it can come out a little bit different than you might expect. And so not sounding robotic when you go to your interview, but making sure you can say the points that you want to make clear about your answer actually come out that way, and getting a little bit of feedback is always good.
Okay. This one, I guess, is for me. What services do you offer that can help students be successful? So there's the residency.teachable.com. There's 3 different courses there: letter of intent, residency interview course, and then the CV. And then the CV course is free. All you have to do is put in the code Brothers for Life 1883 as a single word, all caps. And then you can get into the CV one, which gives you just kind of some access to some templates and things like that. I think the schools do a great job with the CV, but I think the letter of intent has to be kind of a living document that you continue to update as well. What kind of questions would we ask at residency programs at the end of interviews? It's at the end of the 100 questions book from my end. But JC, what kind of questions were you asking at the end? Or maybe you talked about the word genuine during when we were talking about this with MCPHS. Can you talk a little bit about being genuine and not trying to get that right answer, but an authentic answer?
Yeah, when I was doing my interviews, I had read things that said, make sure you ask questions, make sure you have questions. And so in the beginning, I was more concerned of asking questions, whether I really wanted to know the answer or not. But then after time, kind of going to mid-year and stuff, I realized, there are things I actually want to know. I should probably just ask those questions. And so I think being genuine is what I learned to make the most of it. You're also trying to make sure this is a program you want to go to. And so if you genuinely want to know what a typical day is like for a resident, ask that. I think that's a fair question. So I would ask that sometimes, or if it wasn't something on the website, that's something important too. Don't ask a question that's on the website or already given to you. But sometimes I would ask what type of positions that residents obtain after completing the program. Is this going to set me up for what I want to do afterwards, or is this program more guiding people into a different place in pharmacy? I also liked to ask about how feedback was given. And kind of going along with that, I would ask how much autonomy residents got versus being guided. Are you treated like a student? Are you treated like a resident? Most of the time it was similar. It depends on um, you and how comfortable you feel, but it's just nice to ask to get a sense of how their program takes things and does things. And then another thing was the staffing opportunities. If that wasn't mentioned on the website, I liked to know about that. And then even just what's in the area. If this is a place I'm going to be living for a year or more, I wanted to know, does it have the things I like to do? What's in it, places there. So yeah, just being genuine in what you really want to know. You can think of probably more questions than you know, but looking up online in the beginning to guide you is a great place to start.
Yeah, I remember going to residency with my wife. We both matched in the same year, and I was just adamant that we be near a university or be in a university town, and actually be in that town because it may seem ridiculous that you know Iowa football would be part of, especially since I graduated from Iowa State, but that Iowa football would be so important. But it was important for me to have that kind of community around. And that was, we paid a lot extra to be near the campus, over on Aber Avenue over there by Dane's Dairy. But I just remember that, I didn't want to live far away. I wanted to be in that kind of environment because it is a year and it's going to be a hard year. And you want to make sure that the time that you do have outside of the position is going to be something that you enjoy. Let's see. So community-based residencies, there are very few in New England. Do you have any recommendations to navigate the 3 positions? So I thought about this one a little bit more. And then if I don't match in the first round, is it worth it in the second round? Let me do this. Let me make that 2 questions. So I'm going to cut that one. And that's kind of the answer to that one, and do this. All right. So first, I would say if you don't find community positions, I would try AmCare as kind of kind of close to the community kind of thing that you're going to do, which is one-on-one with the patient, those types of chronic disease states, diabetes, hypertension, and those types of things. I think that the whole community versus ambulatory care, and my wife went from a community residency graduation to community pharmacy position to an ambulatory care position to now an academic detailing position. So I think that not having to be constrained to just 3 choices is the bigger issue, that you really want to have more opportunities to do the things that you want to do. So what would you think in terms of, not having that many available, JC?
Yeah, that's tricky. You go from so many in the beginning of just all residencies. I guess I don't have a lot of expertise in the community. I didn't apply to any of them, but
Okay.
yeah, probably more like you said, just seeing if it's going to be a good match for you, and go for it, or look beyond there, not necessarily applying only to those ones. And it is not an easy yes or no whether to apply or not. You can't just say, yes, apply, you'll get one. Don't apply, you're not going to get one. It's not very black and white, I guess.
Okay. If you don't match in the first round, is it even worth it to try for the second round? So this is something that I want to look at tomorrow. And I'm assuming that ASHP is going to put up the update the PGY1, PGY2 match stats. So what they did was they put up the match stats for PGY1, and every single college of pharmacy had someone match. But when you only have 300 spots and you look at the number of people applying, it's reasonable to expect that there's going to be a significant number of schools that have 0 matches. And what I'm curious about, and I don't know the answer to this yet, how skewed that distribution is. For example, does the West Coast only take UCSF and Southern Cal students? Does the Midwest only take Iowa, Minnesota, and a couple other top schools? And then does the East Coast only take, or the Mid-Atlantic only take UNC and Kentucky and, those types of things? And so what I'm concerned about is there kind of a reasonable expectation that below a certain line, and I'm going to say probably top 50 schools of pharmacy, is there a really, 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 really low chance that someone's going to match such that it would not be worth it to go for the second round? And I don't know that answer yet, but I'm hoping to figure it out. And what I found was the top 10 schools of pharmacy earn 500 placements. That's not top 10%. That's just the top 10 schools. And the very bottom 10 schools earn only 50 placements. So that's a tenfold or logarithmic difference just based on what school you went to. So I don't know. It's going to depend a lot on where you went to school. But JC, would you say it is worth it to apply to a second round if someone did not match in phase one?
Um, I think that's a very personal decision. That's really hard to say. And like you said, you'll see what the stats look like. And I think it also depends on how much were you wanting a residency? Are there residencies left in phase two that actually fit what you want? Are you just doing it to get one? Then sure, go for it. Keeping in mind it does cost to apply again. Or if you were a person that just kind of applied for residency because it seemed like the thing to do, then maybe, phase two isn't for you if you're not all in for it. So a difficult question to answer again.
Okay, but very personal choice. That makes a lot of sense, actually. What is something you wish somebody had told you about residencies prior to beginning one? I guess I was so tunnel vision focused on the residency as a path to a teaching position, and certainly didn't know about community college positions at the time, that I was thinking school of pharmacy, working in some capacity in a pharmacy while teaching and something like that. And I didn't realize that maybe I could have done an MBA working 20 hours a week in retail and made the exact same amount of money working half as much on in than I could have in a residency. So basically a residency will like consume your time at 50, 60 hours a week when you include staffing and all the projects and all of that stuff. When I could have just worked retail for 20 hours a week, worked for half the money, and found a type of maybe master's degree or certificate program or something like that, where if I was more clear on my goals to attain some form of teaching, it didn't have to be pharmacy, then I would have looked at other options. So that's what I'd wished somebody had told me, that you really want to get out of that tunnel vision of residency only, because there are so many options out there. When you think about, okay, well, I don't need to make 120,000. I'll struggle with 60,000 or something like that, whatever it was that I was making 20 hours a week. So it wasn't really as big a deal. Anything that you wish somebody told you about the residency process, I guess, JC, beforehand?
To start early, looking at programs, and I tried to look early, but I think just having that and getting a mentor early on that's gone through it, I think is helpful too. They'll give you odd tips that you didn't know about.
Okay. Is it a liability or a strength to be over the age of 40 when applying for residency? What are some assets to highlight in interviews? I think this is the question of ageism. How big is ageism a deal? Because the outgoing residents are probably not going to actually be with the incoming residents. It's not like they're like, oh, I don't know if we'd hang out or something like that. So I think the age is actually an asset for experience. And I think the big five that you need to focus on, clinical, research, teaching, leadership, and service, are the same, but somebody who's 40 has an advantage in that they may have much more service and leadership experience, especially if they are in the military and delayed their pharmacy school entry in some way or another. But I don't see it as a liability. Any thoughts, JC, on that one?
Yeah, I think I agree. No liability, but you could have strengths in other areas. Like you said, that experience too is there, whether it be in different areas. You have life experience, you have maybe different leadership experience. So yeah, I think it's a fair application.
Okay. Since many conferences and showcases are shut down this year because of COVID, other than mid-year, and I know that should be capitalized, that's why that's like that. How do I reach out to specific residencies that I'm interested in that would usually occur during a fall showcase? So this is what I found out anecdotally from people that were doing it. The real conversations happen outside of ASHP. So let's pretend that we're in a normal year and we go to showcase and somebody says they're done. Well, the real conversations don't happen during showcase, they happen afterwards. So whether you're at a state meeting or some kind of group like PLS or ROCI or something like that, that's when they have, maybe beverage in hand, are, in a position to actually talk freely, don't have their guard up. It almost seems like a castle where you have like the PGY ones in the first line, PGY twos in the second line, and then residency director in the tower, like behind them. And it makes it even more like a castle because, like, if you look at like UNC and Iowa and NYU, like you see these flags kind of fluttering, so you can find theirs easily in the hall. And it's just kind of very military, like protect the RPD from somebody asking a question that's on the website, and so here are this mass of people trying to get to the RPD. And then when you look at kind of the state associations, it's the exact opposite, where you might have the RPD talking to 2 or 3 people in a very casual manner. And so what happened this year, or the COVID year, was I was hearing that the schools were doing their own thing. And if you weren't in those own things, you weren't really in the conversation. And that's where, if you're talking about before the interview process, before applications, that's really where you wanted to be. JC, what was your experience in terms of outside of ASHP and the showcase and all of that?
Yeah, kind of like you said, with those own like meetings that they had outside of mid-year, there was a lot of just webinar group meetings to attend, and a lot of them actually. And so I would attend the ones that I could or that I was interested in, and it was a great way to be in a group asking questions, getting your name out there ahead of mid-year or after mid-year to do follow-up questions. Even sometimes when I would email RPDs or residents at different residency programs, they would offer to set up Zoom meetings or other platforms. And I would take them up on it. And it's great to just see them in person. Well, not in person, but actually see a face versus just typing things out. So that was my experience. And I think it was very helpful. I'm a very visual person rather than just reading what they type. It was great interacting with them in the way that we could during COVID.
Okay. Let's see. So tips and tricks for answering questions during residency interviews. The one word I took away was tone. I just felt like when I heard, and I was in on some of these interviews, I could hear the confidence of someone who maybe did a longitudinal one where they've, had 4 or 5 APPEs that were in acute care, or same thing with ambulatory care. And you could just feel the depth of their understanding and knowledge. And it was just so easy to say, wow, look at this person. And then on the other hand, sometimes you could see that there was a mismatch, somebody just kind of going for it within acute care when all of their background said ambulatory care. And it wasn't that someone with AM care can't do acute care, but there was a mismatch. Like they said they wanted to do cardiology, but maybe had not had that rotation yet. And so they asked them a cardiology question and they didn't really have such a good answer. So I guess that confidence in practicing, like you said, JC, that, not sounding robotic. What do you think? Tips and trick for answering questions?
I think writing down your experiences and your APPEs is very helpful.
Yeah.
Because you'll get asked questions based on that, and maybe it'll be asked in a different way, but you're like, oh, that was an ethical situation, I should talk about that, or that was a time a patient was treated correctly because of some recommendation I made. And you won't remember all those on your interview, but just writing those down ahead of time and then playing out or being able to use the STAR method, the situation, task, action results. So you can explain it to them in the interview, and then the result is always a great way to end. Was it successful? Was it unsuccessful? And then why, or what did you learn from it?
Yeah, I think some residency schools actually have to do like 75 cases or something like that, and putting that into the system actually might be, instead of just saying, okay, I've got to get, I'm on case 65, I'm moving along, but to actually in some way put tags on them, so you're like, oh, okay, so this was an ethical dilemma, that's something I'm going to need maybe for interviews. But that's great idea. Best way to experience or try to see if you like to apply for residency. And I know that many will on the ASHP side would disagree with this, but I recommend that every single student apply for residency, because it forces you to think about yourself as somebody who's going to be working in a job, and forces you to think about what kind of jobs you would or wouldn't want. But I remember talking to a student who used my letter help and decided not to do residency, but earned a job that paid 2.5 times residency. And she was able to get a really great job that it wasn't just, okay, I got to get a job, but that really fit her, because she had taken the time to think about it. And sometimes in writing those letters of intent, you realize, wow, I really want nothing to do with the residency. And that might be just as valuable as well. But how did you experience, what it was like in the application process, JC?
Yeah.
Or let me rephrase it. How did you, when did your residency journey start? Let's put it that way. Like what was it that made you say, yep, I'm gonna give it a shot, I'm gonna go for residency?
I guess it was always talked about in pharmacy school, and I didn't always know I wanted to do it. But as I learned more about it, I realized I did want to develop myself professionally more, and I want to do ambulatory care. And so most of the jobs I was looking at required a residency, or it was preferred on the job listing. And so I felt like that was the route I should go. And I find it interesting that you recommend all students apply. I have never heard that before, but it does make a fair point that I remember those days, nights, just staring at a blank paper, trying to figure out how I wanted to write about myself and why I wanted to go there to this specific program. Like, oh, I want this and this, but how do you formulate that? How do I talk about myself and form that together? And it was a very trying on me, but like you said, it did set me up for whatever else I wanted to do, and made me think about those things, forced me to think about what I've done in my past, how that's going to apply to my future. And I think it's a great way. It makes you look at your resume and get that in shape. And so, yeah, I think just bringing it all together is great. And even if you don't go for the residency, sure, it would set anybody up for a good job, and you're prepared for many things on the road.
Okay, let's go to the next one here. So, what is the benefit of a residency over not attending residency? So, I think the residency gets, I put that clinical positions are only available to residency trained pharmacists, and that the residency really is, again, a tool that gets you to a certain place. So, if you do want to work on patients with cardiology, residency is some way to do that. Maybe some of the clinical positions are only available to residents. And I think because the other roads are not as well paved as this one, and in general, I know that some pharmacists just like to have a plan and like to have a path and like to, not not all pharmacy students are super risk takers. Let's go be an entrepreneur who's going to start our own company or something. They're just like, well, this makes sense. It's a logical progression. But I don't, I think it just means that it's going to have an established path with an established endpoint, which makes it a little bit easier. But I don't know that it's necessarily my life is over if I don't attend residency. So what about you, JC? What do you think about, what were the benefits you were thinking about with the residency?
I think exactly what you put there. The clinical positions are available. So I was thinking, if I really want to do ambulatory care at these places I'm looking at, that, yeah, I I kind of have to do a residency, or the alternative could be maybe working somewhere else for a few years to be able to do what I want to end up doing. But yeah, I think it just depends on what you want to do.
Okay. I think these are for me. How can you use your podcast to help students guide their way? So there's almost 400 episodes. Just put in what keyword you're looking for, PGY2, I don't know, like residency interviews. It'll just come up, but I've answered almost everything, and I'll have to figure out some way to do like a podcast a day thing now that I have over 365. Todd Urey from the Podcast Network asked me to do the Pharmacy Future Leaders podcast, which I did, which I then turned into the Pharmacy Leaders podcast, which then became the Pharmacy Residency podcast. What did you do when you applied for residency? I went where my wife did. Let's see. How can a applicant stand out? I think this one is really the idea of matching and going back to the idea of a match rather than trying to beat someone based on their ability. Like I've got the best leadership positions and the best GPA and things like that. It's more like, well, I've really helped people one-on-one a lot. I've been in community and ambulatory care. So I feel like I am the most ambulatory care-ish person that you have met. So I thought, positional needs, although most of my players on my soccer team can play anywhere, soccer goalie is a very, very specific position with a very specific skill set. And certain people are going to match that position better than others. What were the ways that you tried to stand out, JC, or how did you feel you stood out during the process?
I definitely tried to focus on the things that I liked. For example, I really felt passionate about diabetes, or I do feel passionate about it. And I was able to complete a really cool project during one of my rotations. And so that's what I kind of focused on. And then other big things that I did was teaching a class at the University of Iowa and kind of helping create that. And so that's where I spent a lot of my time. And that's where my likes and passion lie. So that's what I focused on, are the things that I do and enjoy. And I think that's important for anybody, like whatever you like, put that out there, focus on it, and be concise with what you have to say.
Okay. Daily routine. I always just said it's an APPE on steroids, and it's going to change from day to day, but you're going to be multiple projects, multiple committees, all kinds of different things. It's going to be really tough to answer that one. Non-negotiable factor. The one thing that I thought about that I don't know if students think about is getting a highly recommended on the application, on their recommendation, really, and how it is that you get that. And I think, Jace, you mentioned this, maybe you could elaborate more on it, but a lot of times you'll accept that somebody, not you, JC, but a student will accept that the preceptor just didn't really have time to do the midpoint evaluations. Don't worry about it. We'll just do it at the end. It'll be fine. And I think that's a real disservice. I think this kind of brings me back to, I used to wait tables at Pizzeria Uno on the Baltimore Inner Harbor. And one thing that we did was after 1 minute, we would go back to the table 1 minute after the food was served, because that's when most of the problems come. So, hey, I don't have a fork, or I don't have salt, or I don't have pepper, I don't have ketchup for my fries, whatever it was. And I think that if you don't ask what the midpoint correction is or the course correction is early enough, and I think this should happen actually probably second week rather than third, then it's really hard for you to fix things, or you can't fix things on that last day and you get a bad recommendation. When if you had just known, oh, that's what you wanted when you said you wanted me to write up a case, or this is what was the most important thing. And to ask that question, like, well, what is most important here that I can serve the patients best? So, JC, what were your thoughts when you're talking about kind of getting that feedback and making sure that what that you thought they wanted is what you were doing?
Yeah, I guess ahead of time I kind of had my own goals for each rotation. And sometimes I would just start working on them on my own. And then other times, preceptors would give me feedback without me asking. Otherwise, sometimes I would ask, be like, is this what I'm supposed to be doing? A lot with COVID, too, things had changed. And I didn't always know, if I was supposed to do something or not. And just having that reassurance, being a student is sometimes nice because it's a very odd place. You can do some things, you can't do other things. And so the feedback part, every preceptor is very different, but I think if you ask for it, they should be able to give you some. And so, yeah, having it early on and having the time to fix it is always good. And even if it's positive feedback, then it's reassurance that you are doing it right. And maybe there's nothing to change, but you can keep going in the direction you're going. Or if it is some negative feedback, then it gives you something to work on. And I think that's always a great thing, too, to have something to work towards.
Okay. Unique experience that stand out. We kind of answered this, but really, when you talk about unique experiences, I think they really want you. So there's this kind of thinking that the interview committee is hoping you mess up, and that makes it easier for them. They remove one application, but they're actually looking for the opposite. They're actually looking for just a phenomenal performance. They are looking for a really polished presentation where they might learn something, or maybe they get a laugh, or whatever it is, but they have to do this over and over again. So they're looking for, man, that was cool, that was really neat, I'm glad you shared that. And that usually comes from being genuine, again, that we've talked about, where you've shared something that is unique to you. I think TLDR Pharmacy's Brandon Dyson was talking about how teaching, he taught guitar, and it's like, whoa, you know, how am I going to surprise you? Well, that would have surprised me, those types of things. But I think one of the things that does stand out is having actual work experience. So if you're ambulatory care, how much ambulatory care clinic experience did you have, or were you actually doing some work that way? And then hospital pharmacy work experience, so critical to have that, to know for staffing and things like that. But I think, JC, you touched on unique experiences, but anything else to add with that one?
I don't think so. No, I think I've said mostly everything.
Okay. Leadership positions and research, that's really on the rubric. Just you get a certain number of points. Any websites that residency describe different programs, um, really great programs. Medical residencies do this, but I found on social media, pharmacy residents, because there's not as many, are too scared to do it. Reddit is one place that you can find pockets of this, but really, really asking the alumni of the site. But I don't know that there's any resources or websites that way. Uh, what would you have told your younger self? This is kind of knowing yourself. I like to start and finish things, but not do the in-between work. So as a resident, I am doing the in-between work. And so that's not a good fit for me. I don't have anybody to work for me. So that wouldn't be good. If I, as a resident, were allowed to have employees, that would have been fine. But that's a little bit weird. What about you? What would you, JC, like to have known before the residency application process that you could have told your younger self that was a couple months younger?
Probably better defining what I wanted out of a residency, which is a question you get a lot of at the time. And it's more of just like a general answer I thought of in the beginning until I was able to solidify why I wanted to do it. But if I had thought through that throughout pharmacy school and came to a conclusion of what I really wanted, I think that would have helped make the writing easier for the letter of intents. But honestly, it was a good learning process. I don't know if there's, a right way to do it. It just really made me dive deep into myself and being able to write, which is not one of my strong suits.
Okay. What can I do on my APPEs that will be certainly beneficial towards the residency? I think we had touched on this. Highly recommend. Does work go home with you? Absolutely. Let's see. Is it possible to work locally in retail while completing a residency? I think in community, maybe you pick up a weekend shift or something like that. In hospital, I think it's pretty unlikely. I would focus on maybe some kind of passive income or flexible hours side business. Mistakes students have made. generic letters of intent or copying from the UCSF and ACCCB templates. But let's talk about this one. What are the most common weaknesses you see people mention in their residency applications? I think lack of hospital work experience applying to a hospital is one that I see quite a bit. And it's not a weakness in the person. It's just that they're applying to a hospital for a job. So there's an expectation they'll have experience. What about you, JC? What do you feel are maybe weaknesses that someone could shore up ahead of time before the process?
I think having actual patient experiences that you can talk about is important in both the letter of intent and your interviews, and not being vague about what you want or what you would do in a situation, but actually talking about those experiences and what you did. The specifics are better. And I think that was one of my weaknesses in the beginning, is not being specific with my actual patient experiences. And then just silly writing mistakes. I know somebody else had made like a typo in the address or something of the RPD, but that could also happen throughout the letter of intent. So just having other people read it, because you know what you wanted to say, and it might get overlooked by yourself.
Yeah, I've seen because I look at the letters of intent. I fix this, but I've seen it where they forget that they put the name of the residency site at the bottom. And so they've just told the residency site, I really want to go here, but it's not there. And it's a different one. And I remember a fellow high school student who had put, I really want to go to Wake Forest, to her Virginia application. So that didn't go over well. I know. It's like, but hey, I mean, you're doing like what, 12 to 20 of these. And it's just like things like that happen.
Yeah.
And then how do I prepare for residency interviews? I think we touched on this. So the points course, residency.teachable.com. And then, that book on 100 strong residency letters of intent, or the 100 strong residency interview questions, answers, and rationales. But JC, any final words for somebody that is, because we were talking to PLS, so these are going to be the leaders in whichever school. But talking to the leaders, what would you say to the leaders of the school if you had maybe the president vice of PDC and Kappa Psi and PLS and ROCI and all of that? What would you tell the leaders about how they could help their membership improve towards residency?
I think having the confidence of going all in. You have to know that it's what you want and to prepare well for it. And then, just go all in, write a lot, because you're going to have to sound good in your letters. And then I just think a mentor is very helpful in keeping you on track with everything. Do you do this? Do you not do this? And how to proceed time-wise, and meeting with programs. And it can get to be a lot, especially during your APPEs. And if you have a job on the side, organization is key. But yeah, going all in if you want to do it, and making sure that's the road you want to go on.
All right. Thanks again for listening to the Pharmacy Residency Podcast. Hopefully that was helpful. It was just kind of neat to talk to a group of P2s and P3s who are thinking about residency, and knowing that they are so early in their journey, although the school I was talking to was a 3-year school, that they were so early in their journey that they can make those mid-course corrections to make it so much easier to get a residency, getting the right APPEs that align with the residency they want, knowing that they need to talk to a preceptor and make sure that they are on the right track in the middle of that time. And so important that you understand the process of residency as much as the application itself. So again, thanks for joining me. And you have questions that you have, you can always contact me at tonythepharmacist@gmail.com, or some people like to use Facebook Messenger.